how we can best use TTouch in, to help with vets and rescue and all sorts of things. And so I thought that it would be really great to have her share one of the webinars that she's done about the veterinary perspective. And I've invited a lot of the instructors, for those of you who are in the pilot course, because we have such a small group, we thought it would be nice for the other instructors to be able to see this as well. And we have Lucy with us. Good morning, Lucy. And let's see who else came on. I think that is everybody right now. I know there's a few more people joining us as we go along. So what I'd like to do, Daniela, is have you maybe go through it, and then if people have questions, we can do it at the end.
Okay.
Does that make sense?
Can I ask a quick question to start?
Yeah.
Can you see that I'm here?
I can.
Does anyone have a tip as to, should I be able to see everyone again?
Look at at the top of your screen, there should be like there should be some little boxes. Like if you take your cursor up there, sort of to the top of the Zoom, and sort of move it across. Can you see any, let's see if this shows anything.
Before it said show gallery view, and I could do that and I could see you, but this time it doesn't.
That's weird.
Can you see me?
I had a problem with the gallery view today too, and I don't know why.
You can't see it? It's weird. I
just see the first 5 people.
Ah, that's strange. Well, I don't know. Hey, Flo's with us. Good morning, Flo. So
Robin.
What about you, Lucy?
Yeah, I just want to say I had the same problem. And if you reach at the bottom of that little, where you see 5 or 6 people, you can actually stretch the window, and then there's more people that you can see.
Haha. Yeah. Now I can see you, Lucy.
Right. Does it work for you, Jen?
Yeah, there's an arrow, but she can't see anybody, right, Jen?
I see who's speaking. It flicks between who's speaking.
Okay, so you've got it on speaker view at the top. So in this little, like at the very top where there's,
it says, mute, stop video, share content, participants, or the 3 dots.
Okay, so what about at the top of where our little pictures are?
I just see you at the bottom.
Okay.
I'm so sorry. You're ready to get started.
It's okay. I think I don't know why I have to tell you, because I don't know why. Sorry.
Okay. Well, I'm a good listener, so I'll listen.
Okay. Well, yeah, that's the most important part, right? So we can listen. All
Thank
right.
you all.
I'm glad you used the same link, because my original one didn't work, but I found an old one. Thank you.
Okay. Okay. Yeah, Zoom's making it a little bit more challenging because they're looking to have the security a bit better for all the times that they get hacked, which isn't so much fun, but anyway. So actually, Jen, I'm going to give you one more suggestion. Can you see where you see my picture? Is there a thing that says Talking Robin Hood?
No.
No. Okay.
You're just in a little box with, oh, I did it. Just wait. I see 3 of you now, and 2, Daniela, Robin, and myself. Okay.
Yeah. So that could be where you need to hit there could be like a little arrow one way or the other if you want to see, but I find it easier when we're doing a PowerPoint to shut off the people anyway, so you can see the whole screen. So.
Okay, well, I see Daniela and Robin. That's a good start.
Okay.
Thank you.
All right, good. Okay, so welcome all of you who made it, and I'm going to let Daniela then start, and we'll hope that it'll actually, the PowerPoint sometimes gets frozen, but it should be okay now. So I will turn it to you.
Okay, thank you, Robin, for inviting me. And I would like to just suggest that everybody who is not talking just switches out the microphone, because otherwise we get some background noises. So the topic of today is the telling and TTouch method from a veterinary perspective. And obviously there is not one veterinary perspective that fits all kind of different veterinarians. So it will be my veterinary perspective. And as many people who joined today don't really know me, I will give you a short introduction who I am and maybe what's my way to look at the telling in touch method. So I'm a veterinarian for nearly 20 years, and I also became a telling and TTouch practitioner in the same year as I graduated from veterinary school. So one thing that's about maybe special about me, I cannot compare how it would be doing veterinary work without TTouch and with TTouch, because I always did it with TTouch my whole life. 18 years I spent it working in a holistic veterinary clinic, meaning I did all the things you do in general practice, from seeing puppies to doing surgeries to do all kinds of things, but always with a focus how you can combine Western medicine with holistic approaches like acupuncture, homeopathy, herbal things, and obviously telling and TTouch. Actually, when the owners of the clinic employed me, one of the reasons they chose me was that I was a telling and TTouch practitioner, so they were kind of ahead. I left general practice nearly 2 years ago and only do behavior cases now. So I have a certification in behavioral medicine. And next to dogs and cats, I really like to work with other species. I have a special interest in reptiles and zoo animals. And I think this is important even when we talk about dogs and cats today, because many of these animals cannot be forced to do something, because we just cannot force a rhino there. Or even if you look at these tiny looking Przewalski horse stallion, it's not really easy to force them to anything. And this is something that teaches you how you can do medical procedures, even when they are painful, with dogs and cats without force too. And as I said, I was lucky, so I learned telling in touch when I was I started learning telling in TTouch when I was a teenager, and this kind of supported me from doing several weird things that were taught at the university in that time, because when you come into the first clinical year, it's mostly about how to do an exam, and how to do an exam. The first thing is to learn how you can track animals, hold them, squeeze them, do all kinds of things. And I was quite good in exploring.
Your sound went funny for a bit, but maybe speak again and we'll make sure it's okay.
Okay. Yeah, and I just grabbed the headset just in case. So I hope it's better now.
Yeah, it's better.
Okay, so then I just continue with these. So I was quite good in ways to my tiny TTouch tools at that time, and I'm very lucky about that. So today I would like to talk about two aspects that might be helpful from my veterinary point of view. One is to help all of you who want to work with TTouch professionally, how you can improve your communication with veterinarians. And I will give you just a few ideas today how you can convince the veterinarians in your area that it might be a good idea to cooperate with a telling and TTouch practitioner. And my main focus will be today, why is TTouch so helpful in animals with chronic disease? And chronic disease quite often means chronic stress. So I think it's good to know a few things about veterinarians, and this is true for pretty much all countries, but it depends on the country how important it is. So usually veterinarians are really busy and have a tight schedule. They are used to work many hours a day, and many of them have to see a lot of patients per hour. So time is an important aspect, and if you can tell them why Tellington TTouch is not only nice for the animal, but also can help to save time to do a treatment. This might be a good idea to get them a little bit interested. Time is money, obviously, and many of them, especially in the United States, when they finish university, they have really high debts because veterinary medicine is one of the most expensive studies you can do. So especially for young vets, they have usually quite a lot of pressure on their shoulders, and that means when you meet them the first time, it's a good idea to keep the communication short. And when we are new to Tellington Touch, at least it was true for me when I started, we get really excited. And when we get excited, sometimes we have the tendency to explain too much because we want to share so many great experience. So kind of slow down a little bit and keep focused on a few things that might be helpful for this person. Make really clear that you don't compete with them. You don't offer any medical treatments. This is also important because in many countries you are not allowed to do any kind of therapy when you're not a veterinarian, and you have to be careful with your words. And it's a good idea that you make really clear that you have things to offer that makes their work more efficient and safe, because there are so many accidents, especially with cats, that injure veterinarians and cause health issues that are long lasting, and sometimes like fingers that are broken forever. So helping them to work efficient and safe might be a good starting point when you talk to them. If you want to communicate in an efficient way, it's good to have informations. So veterinary medicine in these days is a really wide field, from a general practitioner who is treating all kinds of species up to really specialized colleagues. And when you know what they are especially interested in and what their specialization is, you can think more focused, what can I offer? For example, if you have an orthopedic surgeon, he obviously already can fix joints. So it doesn't make sense to talk too much about what TTouch can do for patients with arthrosis, because this veterinarian will be quite confident that he can fix the arthrosis problem. Maybe with a bigger procedure or surgery or whatever, but usually he will have a solution. So, but he doesn't have a solution how to keep an animal calm after a surgery. And if the animal is moving too much and too fast, you will get problems, and maybe the surgery will not have good results. So you could offer ideas how to help the dog the weeks after surgery, or how to help the dog being calm in the vet clinic the hours and days after surgery. Or let's say if you have, like in the middle on this picture, a veterinarian who's doing acupuncture, it doesn't make so much sense to talk about how you can change or how you can release tension in the body, because he can do this with his needles too, maybe in a different way. But if he needles an animal and the tension is gone, usually or quite often it comes back, because the animal still have his habitual movement pattern. So it might be an idea to talk about changing habitual pattern by using the playground of higher learning, or by doing TTouch, or by using Tellington body wraps. I don't know if it's true for all the countries because I don't know the situation in South Africa very well. But when I look at Europe and when I look at Canada and the United States, I see kind of two groups of veterinarians. And this is simplified, but there's one group that really noticed that stress in the vet clinic is really bad for the animals, and they start to focus on aspects that help to reduce this stress. And many of them are certificated by different programs called cat friendly clinic or low stress or fear free. There are like several certifications. And when you talk to somebody who has a certification like this, you don't have to talk so much which problem stress is causing because they are already aware. Here's the question: what ideas do TTouch offer that they don't have in their programs so far? So it might be a good idea to look at these programs in detail and then see what you can offer additionally. And there are many things we can offer. On the other hand, if you have a veterinary clinic who is not taking a lot of care about all these aspects, you have to be a little bit more aware that sometimes TTouch is not enough. If you have like a cat that's already totally upset and stressed because it was sitting in the waiting room next to a big dog that was growling and barking all the time, you don't have a very good chance to relax this cat on the veterinary table. So in these cases, you have to be careful that you don't offer techniques that don't work in this environment. There it might be a better idea to say, well, we can start, let's say, for example, in the waiting room, that you make it a little bit easier for the cats. You separate them a little bit, and then you start with showing some TTouches for the owner at home. And when the animal already knows it, it will be easier for the cat in the vet clinic too. So you have to really look specific what's working for the individual veterinarian or individual clinic. In summary, what you want to do is you want to help them to do their job better. And it's always a good idea, because most of you will have dogs or cats or both, that you invest time to make your animal a really easy to treat animal in the vet clinic. So you have kind of a role model. And sometimes when your animal behaves really nice and you do, for example, ear touch in the exam room, veterinarians get interested. Why is your cat or your dog doing so well? So if your animal is still struggling with veterinary exam situation, it might be a good idea to put a lot of energy in that to improve that. And sometimes you will run in veterinarians that are not interested at all. That's just how life is. And then sometimes it's easier to talk to the vet nurses or technicians, because these are the people who have to deal with the animals when they are in the clinic and do all the daily work, giving medication, cleaning the cages, bring them outside, etc. So they usually spend more time with the animal than the veterinarians. And usually they are, I try to remember, but I don't think I ever run into a vet technician or vet nurse that wasn't interested in learning some TTouch tools. And in this case, again, I would think about what makes their life more easy. A simple balance leash when you walk a dog in and out. If you have to do this with 10 dogs, it makes a really big difference if these 10 dogs are pulling like hell or not. So give them easy tools to begin with that helps them to make their life easier. As I already said, avoid medical terms and know the laws in your country. In Germany, for example, you can do some medical things without being a veterinarian, but Austria, for example, is very strict with that, and you just have to know what the situation is in your country. And when you talk to people, what happens quite often is that they ask, how do you know it works? And there are many different levels to answer this question. The easiest, but sometimes not efficient one is from your experience. That works well when you already have a trusting relationship with a person. Then sometimes it's enough that you know from your experience that it works. But if you talk to somebody the first time, it's probably not enough. And then you can say, well, sometimes from the experience of my colleagues and me, or you know how many practitioners we have all over the world from the experience of many practitioners. And we also have some research about TTouch, and it's a good idea to look at these things deeper. This is not my topic today, but one thing I would like to mention is that if you talk about a study, you should have it somewhere to present it if somebody is interested in the details, and you should really know what's in. So make sure that you not know only just a tiny piece of it. Like if they say, well, it's about loading horses, let's say, getting a horse into a trailer, and a veterinarian asked, well, how many animals have been involved in this study? Then you should have the numbers in your head too, and if you don't have them, you should have the paper available to check, and it shouldn't take you days to find the answer. And we have to be honest, and this means that in many situations, we don't know why TTouch works so well. And then it's always okay to say that we don't know for sure. We just have a hypothesis, or we presume that it's because of blah, 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 blah. And we will look at some of these aspects in the next part. So if I summarize, why should veterinarians use TTouch? Because it's not replacing regular veterinary care, so it's not kind of taking money away because they don't need to do their job anymore, but it's complementary in many situations. And if animals feel safe, they are much easier to approach. And there's one aspect I just added, so it's not in your PDFs. Acute stress is really changing the results of the exam. You cannot know what the normal heart frequency of this dog is when it's really anxious in the vet clinic, because the heart frequency will be much higher. You cannot measure blood pressure in a high stressed cat, or you can measure, but you cannot find out if it's a cat with a too high blood pressure that needs treatment, or it's just the so-called white coat effect. And even in blood results, we get all kinds of changes in the blood results when the animal is really aroused or stressed. So as more normal the behavior and relaxed the behavior in the vet clinic is, as more you can trust your results. And I think that's actually a really important aspect. Usually veterinarians also have to take care about the human-animal bond, as better human and animals are bonded, as more are people willing to go to the veterinarian and spend money. So helping them to have a good bond and can be a good idea for veterinarians or veterinary nurses. And one thing that's really important, if you think about places where one animal is where many people take care of one animal, like let's say in a big veterinary hospital where the first nurse comes in the morning, the next comes at lunchtime, and another one in the evening, or a laboratory or a big shelter. There, a great aspect about TTouch is that if you learn, let's say that an animal likes abalone touch, it's really easy to pass this information from person to person if everybody knows TTouch. Because if you say, this dog today really enjoyed abalone TTouches, pressure 2 seconds, let's say, on the chest. Then it's a short sentences and you have information for the next person what he or she can do with this dog too. If I would explain, like if you would just say, the dog likes to be, we take something negative, likes to be cuddled on the head. And maybe he really likes something like this. But one person will understand this means something like that. And the next one will do something like that. Sorry, Foxy. And maybe somebody will do something really soft. So TTouch offers you the chance to need only very short period of time to pass precise information what an animal likes. And that's, from my experience, something that gets people interested who wouldn't be interested just because it's about welfare or so. So I give you a moment to think if you have any questions about what I said so far. And then we will move on to the next topic, and I will come back a little bit to the things I already said. So, any questions? Everybody good?
Looks like it.
Okay. So, if you think about your own animals or the humans around you or yourself, then obviously everybody can get acute problems, acute disease, or acute pain or chronic problems. And I think if we all agree, if the acute problem is not too severe, that's not such a big issue. Let's say today, for example, my colleague's dog came in. She was playing outside with other dogs, and she injured her carpal joint and had a little wound here, so little broken skin. And there are many versions what you can do. You can, obviously, you have to clean the wound. You can use painkillers. You can use TTouch to reduce the swelling. You can use homeopathic drugs. You keep her quiet, and usually self-healing will make sure that it will be okay, and you can just decrease the time for self-healing, but usually it will be good, and it doesn't matter so much if you use Western medicine, holistic medicine, TTouch, etc. There's just one situation where it really matters. If you don't have anything except your hands, then it's really good to have TTouch in acute problems. But otherwise, the big challenges are the chronic disease. Because in chronic disease, what medicine offers is quite often very limited. And chronic disease is always connected to chronic stress. And quite often it's a circle, and you cannot say, well, it's caused by the chronic stress, or the chronic disease is causing the stress, but you come into a circle and somehow you have to break down the circle. And TTouch is one of the things to get a break into this. In humans, sometimes I get the expression, it's all about stress. Everybody is talking about stress. I'm so stressed today, blah, 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 blah. And I don't think that makes any sense, because if I put a word in my head all the time, it's kind of gets stuck, and then I may feel really stressed. So I don't care so much about that. I might be busy, but I'm not stressed. But in animals, quite often, our focus is not enough on stress. We are just not good enough in noticing signs for stress. If you look at this dog, and I think you cannot even believe that it's the same dog in like half an hour difference. And Lisa is with us, so she knows this dog. This was a dog owned by an old Portuguese man walking this dog on the street where we were doing some TTouch work near to a veterinary hospital that's doing treatments without paying for poor people. So just by accident, we watched him, and Lisa made sure that he gets a harness instead of this small thing about the neck, and he was pulling on it, and he obviously liked the dog, but the dog was just, well, as it looks on the left picture. So he got this nice harness. We couldn't use the first one because it had the color of the wrong soccer club, and in Portugal soccer is really important, so we had to choose the right color too. But the dog was really happy, and we showed up half a year later. He was kind of presenting us his little dog again. So we should talk about stress in dogs, and sometimes it's very easy to change things. I hope you are all interested in cats too, because I will have a few ideas for cats too. So when we talk about stress, we notice it's not well enough in dogs, but we are more careful with dogs because they cause more problems when we walk them outside and they are stressed. In cats, quite often they just go under the bed, or you don't see them and things like that. But we have to remember that probably, especially indoor cats, are a high percentage of indoor cats is actually chronic stress. Let's say it that way. And the point about, if you look at evolution or domestication, is that dogs are really flexible because they adapted to many different ecologic niches, from living next to humans in villages, free running, up to being with hunters or with farmers or in our apartments. Cats for a long period of time were not selected for special jobs. Their only job was hunting mice and living next to humans. So the pressure of being behavior-wise very flexible was much lower. And also because of their small size, even if they are hunters, they are also prey animals because they are small enough to get eaten by many other animals in nature. So when we think about chronic stress, I would actually believe that 70 or maybe even 80% of indoor cats suffer from chronic stress. And obviously some with low level and some with really high levels. Originally, many people believed disease is like a brick. So a brick hits you, you get injured, and then you are ill. But in many cases, that's not true. There's not one brick. There are many small things that add to each other and you end up with disease. And some animals are really vulnerable to disease and others get many hits or many stressors and still do very good. And the question is, why is it like that? And I have an example for you here. So on the right, you see this dog called Lily as a tiny puppy. She is a dog from Romania, and the city I live in, Nuremberg, is quite on the traffic road for illegal puppies coming from Eastern Europe. And usually they are on the way to the Netherlands and Belgium, but the police in my area is very well trained, so they kind of catch a lot of them on the highways, and then they end up in the shelter in my area. This is why we see so many of these dogs. So this puppy here was adopted by a friend of mine, and you can see that she grew up and became a pretty large dog. And when I first saw her as a puppy, I said to my friend, and she took me to the shelter to say if there are any bad behavior issues, because she also has a child. And I said, well, I don't see any big behavior problems, but I'm pretty sure this dog will have hip dysplasia. And she said, oh, you know, my last dog had so bad joints, I know what to do about it. So then I will take her anyway, because then we can do the full program from begin on. Yeah, and well, unfortunately, I was true. You can see that on this side, the hip is worse than on the other side. But the important point here is, when we talk about brick or not, this is obviously not a trauma. This is a dog that had some problems from begin on. And what's interesting and not correlated to the hips directly is that she also has a very weak gastrointestinal system. And when she gets stressed, she gets diarrhea and stops eating very easy. And I will explain in a moment why I think, or how this happens from my perspective. And by the way, she's now like 4 years and she's walking very nicely because she gets all physio and TTouch and body wraps. So I don't worry a lot about her. So there's one point about chronic disease, and this has a quite big name, developmental origin of health and disease paradigm. And what this means is just that many of the problems we see in later life actually happen because of events during pregnancy and early after birth. So these events shape the risk for diseases in later life. And the reason for that is that the genetics are obviously there, but still there is plasticity that helps the animal to adapt to external factors. So if you think about this dog you have seen on the slide before, she originally came from Romania. So you can expect that her mother was highly stressed. I don't know if she was on the street or if she was in a shelter, but you can expect that she had high levels of stress. So she had high levels of cortisol during the pregnancy, and this changes the brain of the puppies and makes them more vulnerable for stress too. And it sounds negative, but it's only negative in our environment. On the street, it would be good if you are more skeptical about new things. Here, it's not so helpful because there's this teenage girl she is living with, and if the teenage girl fights with the parents, this dog avoids entering the living room for the next 2 days. And I can tell you, she got never hit, nothing bad happened to her in this household ever, but she is just careful, and if the stress kinds of accumulates, she gets her stomach and her intestinal problems. And obviously with doing lots of TTouch and some other adaptations, she's doing much better now. But this tendency to be skeptical if something goes wrong will probably follow her whole life. And we have to look at this as something not negative. These things are adaptations that make sense in special environments. And we just sometimes put our dogs in an environment they are not originally made for, and then we can run into problems. There is a German researcher called Norbert Sachser. He's doing lots of research about stress during pregnancy and early childhood and so on with guinea pigs. And funnily, he lives in the city where I was born. And if you are interested in these topics about correlation between what happens with the mother during pregnancy and with the puppies, or in this guineas later, I recommend that you Google some of his articles because many of them are available for free. So in summary, we have a much higher risk to get disease if the individual and the environment they live in don't match very well. And with TTouch, we have many options to help the environment and the animal to match better on one side. And on the other side, there are aspects of the environment we cannot change. For example, we cannot move all animals from the city to a farm environment or things like that. And then we can help them to become more stable to stay healthy even in this not perfect fitting environment. And we will have a look at some ideas in the moment. To understand what's going on in the brain and what we are actually doing with TTouch, it's a good idea to understand what are the neurologic changes in these animals. And one is that they have a chronic activation of the sympathetic nerve system, and that they have higher levels of norepinephrine in some important parts of the brain. Important part means these parts have influence on the arousal level, so the animal gets easier aroused even if the stimulus is not very intense. It influences the perception of pain, and it's also changing some responses in the viscera, like I get easier diarrhea or get easier bladder infections and things like that. And when we think about what we do with TTouch, one thing is that we help to balance the sympathetic and the parasympathetic nerve system, because in these animals and in many chronic stressed people too, the sympathetic nervous system is much too active. And with TTouch, with nice anxiety-free, easy exercises and touches, we activate more the parasympathetic and we help to rebalance this. And one of the easiest ways to rebalance sympathicus and parasympathicus is to increase heart coherence, or we also could say it's the other way around. Heart coherence is a way to measure the balance between sympathicus and parasympathicus, because the sympathicus is increasing heart frequency and the parasympathicus is decreasing it. And if they are in a good balance, the heart frequency goes up and down in a regular pattern like you see here. And when we think about the brain and the heart for a long period of time, we were just thinking about our brain is influencing our heart. In reality, there are much more nerves going from the heart to the brain. So if we say in these brain areas, the norepinephrine is too high, a good heart coherence also helps to calm down the overactive parts of the brain. And here on below this brain, you have a heart variability measurement of my own heart, and you see this quite chaotic pattern, and then you see this spike that's artificial. That's when my cat is jumping on my lap, and behind that you see me starting TTouch, and in less than a minute you see the change in my heart currents doing TTouch with my cat. And I did the same with stroking. It's doing a good job too, but it's not working as well as doing the TTouches. And these things are available now on mobile phones as easy apps and things like that. So that might be a nice thing to buy. So I already talked a bit about the norepinephrine. What it does, it makes more irritable and more impulsive. And when we think about a dog that's adapting well, what we usually don't need are dogs that are high impulsive. We do need dogs that think first and react then. So for these dogs, all stimuli have to be dosed carefully to help them to learn. And I think one of the best things where we can do this is our playground of higher learning, because we have infinitive possibilities to make things easier for an animal and to find a solution that works for this individual one. Also, when we move, and movement means in a harmonic way, not like running as fast as we can, movements help to increase serotonin, and they help to improve communication between the left and the right hemisphere. Because if we use both parts of our body, we cannot shut down the communication, otherwise we just couldn't move both sides anymore. And when we do in the playground of higher learning, we do many exercises where it's about turning left and right, like in the labyrinth, and that really makes sure that the two halves of the brain continue to work together. And obviously, oxytocin helps to relax and to feel safe, and feeling safe also helps to reduce norepinephrine. And oxytocin, we know that we already get a peak in oxytocin when we smile at our animals, but obviously we do that with TTouch and with the telling body wraps too. You don't have to remember this hypothalamic pituitary adrenal axis word. The only important thing is, why I mention it, that sometimes things inside are different than we expect from the outside, because we all know that cortisol is a stress hormone. So we expect that it's high in chronic stressed animals, but actually at a certain point, the adrenal gland is kind of breaking down and cannot produce enough cortisol anymore, because it was doing that for such a long period of time. And then these animals sometimes actually have low cortisol levels. And this is why I'm careful about my words. I always say when I talk about hormones and TTouch helps to balance, because we say oxytocin helps to reduce cortisol. But if it would be really straight like this, that would mean we cannot touch these animals because their cortisol is already too low. So I prefer to say, well, we help the animal to balance the hormones. We not just reduce cortisol, because in some situations that might be not the right idea. In general, as with most things, the best area is somewhere in the middle. So for learning, very high level of cortisol as well as very low levels are bad, because to produce factors that help to build the long time memory in the brain, we need a cortisol level somewhere in the middle. And in most animals, if you get a acute stress dog and it cannot focus anymore and it cannot really learn, it can just react, you are somewhere here. So it has problems to build a long-term memory. But in the chronic stress dogs, and sometimes in severely ill dogs for a long time, you also can be on this side. And as cortisol also reduces inflammation, some of these dogs have all kinds of inflammations because the cortisol cannot slow down inflammations anymore. We all know that pain and discomfort increases risk for behavior problems. I have a few cats that always come in when they attack the other cats in the household. And some clever owner says, oh, the back pain must be back because she's fighting with the brother and she only does this if she has back pain and things like that. And obviously, pain and discomfort causes stress, and the stress worsens the disease, and then we come into a bad cycle. So the question is, if we want to change a long-lasting behavior, how can we do this? And there's one idea from a German neurologist called Gerald Hüther I really like. He says to change the connection in the brain, the old pattern has to be activated in a non-threatening way, and a new experience has to be offered at the same time. And I think that's what we do all the time in TTouch, because activating the old pattern is also important. If I'm afraid about black snake or black spiders, for example, and I just avoid the black spiders rest of my life, I will not get rid of this pattern. I may survive and I will not have big problems, but I will put a lot of energy in avoiding. If you put my favorite dark chocolate next to a black spider, I may go and grab the chocolate, but I will connect in my brain the unpleasant feeling of being next to the spider with the chocolate. And if you do it 5 times, I may start avoiding the chocolate too. But if you put me in a situation where I can have enough distance to the black spider that I notice it's there, but I can still feel safe, then I can change my behavior. Or maybe we take one example because it just comes in my mind from my real life. I'm quite afraid about heights, but I have been on the Eiffelturm and I have been on the Empire State Building. And this is because I went with my boyfriend and he was holding my hand I had a trusting relationship, and we did all these steps I was able to do. And then at one point I can end up high in the air. But if somebody was just grab me and put me up there, or if I would never go next to this building, I wouldn't change my behavior pattern. Make sense? Okay. So I hope we can do seminars outside soon again in Germany. As you can see on the left side, this was actually spring this year. So what we do is we offer the chance to have new experience in a non-threatening way, but also activating the old pattern so light and so easy that we have a chance to get new connections in the brain, and use movement pattern in this is very helpful, because as long as the body is moving, we have a much higher chance that our mind stays flexible too. And if you look at the brain of a dog, you probably have seen pictures like that of humans, like little homunculus sitting in the brain, having a big thumb area and a big mouth, but tiny feet, etc. For dogs, it's very obviously that the nose is really important. And if you compare front and back legs, dogs do much more, and cats also, with the front, because they may manipulate food. They are not like an ape, but obviously they can do something with the front paws, but with the back end, they are mostly walking or maybe scratching to mark an area. So this means if a dog gets a problem in the hind end, this area is already not very well represented in the brain. So it's much more difficult to find a neurologic way to move in a different but still efficient way than it's in the front, where the dog has, or maybe in the head, where the dog has more awareness. So helping bringing more sensory awareness with body reps and TTouch in these, let's say, underrepresented areas of the body can be really helpful in any kind of orthopedic or neurologic disease. Because if there's only a little bit of awareness, if we add a little bit more, it can already make a very big difference. And adjust in the dog on the right, I just like the colors. So if we all live in a certain environment, and this environment changed a lot because of the corona crisis, and it depends on personality how much that is doing with your health or not. So in general, you can say you have a spectrum of environment where you can stay healthy. And in animals that had problems during pregnancy or in early life, their flexibility is reduced. So the environment areas where they can stay healthy is smaller. So they can cope less with changes, or with a not perfect environment. Let's say, for example, you choose an example of a cat. One cat will be totally happy if it has one safe place in the house. The other cat needs 2 safe places in every room to feel comfortable and stay healthy. Or same for a dog. Let's say one dog can cope with going to vacation, going to seminars, traveling in the car, having children visiting, and everything is good. And another dog gets really in trouble when the owner is not getting up between 8 and 10 in the morning. And what kind of disease then happens? This is kind of nobody actually knows. So if I have an animal that has already like a predisposition, then this is a cat example, it may get respiratory symptoms, it may get behavior problems. I just got a call today from an owner who got attacked by a cat, and this cat obviously has an acute health problem too, but another cat may not attack the owner. It will work on its own skin, or it might get diarrhea, or it may get bladder infection. Not infection, bladder inflammation. Usually there's no bacteria involved. And in many cases, they will get first one, then the second, then third. And if the veterinarian is not looking in detail, they think these things are not correlated to each other. My partner is a veterinary ophthalmologist, and he sees so many cats with herpes keratitis, but the keratitis, or the body cannot fight the herpes because the cat is chronic stressed. So it doesn't make sense to put all kind of drops in without changing the environment of the cat. And sometimes you don't even need anything in the eye, you just have to reduce the stress. So these are just examples, and you can read that. So what can we do for these animals? We can change the environment, and there's a kind of a technical term that's called multimodal environmental modification. And you don't have to use it, but if you talk to vets, sometimes it might be nice that you know Memo. It's just a good word for do good management and adapt the environment to the individual needs of the animal. Obviously, many of these animals need medical treatment, and that's not your job. And from my point of view, most of them also need telling and touch. So Memo, for example, means that the cat has places where she can feel safe. Many people forget that cats, as hunters of small prey, have to eat like 10 times a day. So forget about food bowls for cats. Is the first thing I usually recommend. They need any kind of activity feeders and finding their food in the house and so on. And to show you how important it is to look at these tiny details, I have a slide from my colleague Gonçalo Graça Pereira from Portugal, and I'm sure it's true for the US and South Africa and Germany and wherever. So they just checked how many cats are in the household, and compared to the number of cats, how many toilets, drinking bowls and food bowls do they have. And in general, it should be number of cats plus 1. So if you have 3 cats, you should have 4 litter trays, and so on. And in 80% of the cases, they have less litter trays than cats. In 60% of the cases, they have less drinking bowls than cats. And still, in even 50%, they have less food bowls than cats. But cats are not group hunters as wolves or maybe dogs in former times have been. Cats are single hunters, so they don't want to share food. They may sit together and eat from one food bowl because they have to, but this has nothing to do, I want to. It's just if I have to decide between staying hungry and eating next to the other cat, they will do that, obviously. And obviously with TTouch, we can do more than relaxation. We can improve how the animal uses the body with the health issues it has. We can improve the relation between the human and the animal. We can reduce pain, etc., etc. But we have to keep in mind that we also have to look at the whole picture, and it doesn't make sense to teach the owners touches to relax the cat, and the cat has just one litter tray and there are 3 cats in the household or things like that. So it's important that we don't focus too much on our method and forgot all the things that are going around too. So I said balance is an important word for me, and maybe we can say, when we talked about memo, that telling in touch also helps to balance the animal and the environment, that they find a good balance with each other, but it also helps to balance, as I said, the sympathetic and parasympathetic nerve system. It helps to balance the blood pressure. So if it's too high, we can help to reduce it. If it's too low, we can do active touches to activate it. It helps to balance the hormone system, and it helps to balance the emotions. And we have to remember, in all these things, there is not good and bad, black and white. So sympathicus is not bad. Arousal is not bad. We don't want to sleep the whole day, our whole life. It's just a question about balance. And also, even if I said the big challenge is a chronic disease, telling in touch can also help to reduce the acute symptoms without causing additional stress. Because if, like the dog you have seen at the beginning, gets a diarrhea, the owner wants to get help with that. She doesn't want to hear only, oh, I will reduce the chronic stress, but the dog has a diarrhea today and you have to get up 5 times a night. So you have to do something about that. And we have telling in touch options for all these things. And to finish, I come to just one study from human medicine to remind you how effective TTouch can be in reducing pain and influencing blood pressure even in severe situations. This is a research where they did 8 minutes of TTouch in a group of men with angina pectoris, and the angina pectoris was not well controlled, so they still had pain attacks, and one group just got the medications they get in this situation, and one group got the medication plus TTouch. And what you can see that in the TTouch group, the systolic blood pressure goes down. In the other group, even if they get medical treatment, it still gets up. And I believe this is because of anxiety and pain, because if you have a heart problem, you're really upset and you are in pain. And when you are in pain, your heart problem gets worse because the heart is beating faster. And with TTouch, we can break down this cycle. You can also see that the pulse frequency goes down with TTouch and goes up with the only medical treatment. And the same is true for breathing. So actually the group with TTouch had worse physiologic parameters before treatment and much better after. And the pain, sorry, I had the pain numbers here. So they had a pain scale, the official one, from 1 to 10, and the group without TTouch had pain, if you put them all together, of 6, and with the TTouch group it was just half 3. So this is pretty impressive. So they summarize that TTouch can be a useful method in people with heart disease, and they especially appreciate that's a simple non-medical method that can be used in ICU situations to reduce pain and to influence some vital signs. So when we come back to veterinarians, it's a good idea to know these human studies, because sometimes veterinarians are more open to results from human medicine than from other animal species. Sometimes if you talk to a small animal practitioner and you have a horse result, it's like, well, it's from a horse, it's not a dog. But as we put information from animal medicine to humans and backwards all the time, usually they don't complain when you talk about human results. It's kind of funny, but that's how it is. So I believe that when you are a TTouch practitioner, that you also have a deep knowledge of the species you work with. So usually you can offer for the veterinarians a combination of TTouch and memo, or let's say good management of the environment of the animal. And I really think that's an aspect we shouldn't forget, or we always have to have in mind enough. And all chronic patients have chronic stress and they need treatment for the chronic stress. And therefore, I believe all chronic patients are good candidates for TTouch. And the problem with these chronic patients is that bringing them to the veterinarian can be really stressful, because they already had many bad experience, too many medications, too many stitches, and so on. And the acute stress can, in these animals that are so vulnerable, can cause acute symptoms. So you may run into a circle that people don't bring the cat to the veterinarian, because after that she's peeing in the house because she get a bladder inflammation again. So that's a really good argument that you can offer options to help the owners to learn techniques, that the animal is not stressed at the veterinarian anymore, and therefore you don't get into this bad cycle. Because especially in cats, many people don't bring their cat to the vet, not because of the money, it's just because they don't want to harm the cat. And actually they harm the cat because they go too late, and then you have bad disease and all kind of changes you cannot take away anymore, because, for example, high blood pressure over long time is causing many secondary damages. And if we help people and veterinarians to understand that there's a way to do this without stress, then actually veterinarians see patients earlier and it's less frustrating, because you can help them much better. So to summarize, from my perspective, every vet and every vet nurse should know the TTouch method and should cooperate with a TTouch practitioner in the area. And I do my best working on that. And I think you can do a lot by working on this goal too, by promoting the method with enthusiasm, but also with honesty and accuracy. And sometimes it's also about balancing our enthusiasm and the accuracy too. So I thank you for your attention, and I want to thank Linda for bringing TTouch so early to my life and prevent me from so many things I would have done with animals if I haven't known her method. And I thank Robin for many things, but especially for organizing this whole course and for bringing structure, because that's something important for me too. And I thank Katja Kraus, who is doing so many pictures I use in my presentations. And I haven't had a good picture of her, so you see a picture of her dogs. And I want to thank Gonzalo. You have seen one slide from him. And he's a behavior colleague in Portugal, helping organizing the training there. And he was bringing my attention to chronic stress in cats, and I'm thankful for that.
Oh, fantastic. So I think if people have questions, they could just unmute themselves and ask them. One thing, I don't know in Germany, but like here, the whole fear-free like programs for vets is huge. I mean, which I think is a great thing. And I also see where they could add a little TTouch to what they do rather than just like scratching the animals and so on. But I think it's really exciting that more vets are looking towards changing that. Oh, they call it stress-free in Canada. Oh, the fear-free.
There's a fear-free certification from Marty Becker and some more people.
Yeah, that's what I first did.
And actually, that there are so many different programs now, this is also a marketing issue.
Yeah, of course it is. So so that's really good. And so Lindy, who I think is still on the call, she goes in South Africa until this COVID thing. She went to her vets every Tuesday, and she would work on the animals like that were in the clinic that had stress, or that they would sort of say, do this one and this one and this one. And it was going really well, wasn't it, Lindy? I don't know if you can unmute yourself, or if you're are you still there? Let's see. She might be doing something else. Maybe she's not there. So
there she is.
Yeah,
she's here.
Yay, hello. Yes.
Sorry, I couldn't find myself.
Okay. Yeah. That's always a problem. So
I know.
Yeah.
Sorry, say
yeah, so the situation, so how was that? That went for you quite well, didn't it, when you went to the vets?
It did, and they really appreciated it. We always they kind of would say, "Yay, it's TTouch Tuesday" when I'd walk in.
Nice.
And they have every now and then, when they remember, they actually implement things and get all excited and come to me and say, "I gave this customer a wrap and it's made their dog so different." So. But I have to keep reinforcing it because they're so busy, they tend to fall back to what they know. But
like everyone. I think that's
like
the same thing.
I don't think it's partly busy, but I think even more it's about habitual pattern.
Yeah, totally.
Yes, and unfortunately they've had a huge change of staff, so we have to sort of start again regularly. But some of the main vets are certainly, perfectly happy about it and actually appreciate it when I come in and occasionally ask my advice as to what I think they should be doing with the patients.
Nice.
But as you said, you have to be so careful. So I always am very careful about sort of going to what they say and then maybe adding to that, but certainly never counteracting what they say.
Mm-hmm. It was interesting when you were talking about the the need, so often people, especially in dogs, avoid any sort of confrontation of things that they're afraid of. And it made me remember that in the Human Rap book that I put out in 2012, Robin Bernhard talked about this. It's about the same kind of thing, that they called it deconsolidation. And this Bruce Ecker talked about the sort of the brain's rule for change, and it was in humans, but it's the same. It's the same really with any animal, and so I think all of those things that the TTouch just gives us sort of more tools, but always bringing in some of these other, like looking at things from different perspectives. So anybody else? Marie Miller also, she worked for years for a vet, and she didn't necessarily she did the books for them, but she also ran the puppy classes and so on. And I think that went really well for you, didn't it, Marie, if you're still here? You are, let's see. There you are, yeah.
Yes, it did. I did run, certainly with the vets. They were very hard to convince, and they would tend to come to me as a last resort. And but,
Yeah.
but
We don't
certainly-
believe you, but now you have to fix it.
Yeah. Yeah.
but the veterinary nurses were always on board with it, and they would use it sort of before and after anaesthetics, that sort of thing. And I'm no longer working there because unfortunately we were taken over by a big corporate. So I've now been made redundant after 30 years, which is quite sad. But I have put a proposal into them as a group, because they're a big national group, about sort of TTouch and puppy training. But unfortunately, COVID's knocked that out for the moment. So that's still in being discussed. But I'm hoping to be able to visit other practices within the Medivet group. So fingers crossed that that goes ahead once lockdowns closed.
Nice. Yeah, that would be great. So, does any of you have any questions for Daniela, or just any?
I just want to
Yes,
thank
comments.
Daniela
Yeah.
because I love it when she talks about all the same kind of stuff that I get into, you know.
Yeah. Yeah, it's so helpful. It's really great to hear it from your perspective, and it's good and it's difficult for you in a way that you don't know anything else. But most people, because you kind of came up through having TTouch as your basis, you have a very different perspective on things, I think, than most vets do, because their habits are so strong. And that's the same with all of us, is we go back to what we know whenever we're under stress, and so do the animals. And I always say to people, it's just, that's okay, that's going to happen, but it's how quickly can you have an option if something's not working? And that just takes a lot of practice, actually, I think, and having the tools close at hand in terms of what you know.
And then it's the same for us trying to convince some of the just strict dog trainers and behaviorists that there is this whole other portion having to do with the nervous system and what we call the just right challenge, not overwhelming them and having them understand how this is getting processed.
Yeah, really important. So cool. Well, so it doesn't look like we have questions. I have forwarded to you, all of you, the PDF of this PowerPoint, and I will post the recording in the, we have an online group section, and I'll send it to those of you who were here. It was really, really helpful, and I so appreciate just this other perspective from.
Robin, I had
everything.
one, Daniela.
Yeah,
I had
please.
one thought that I would toss in talking about how to help vet clinics understand that this is useful. That I talk about the economic benefits as well. When a person brings their animal into the vet hospital and the people there, the techs or the vet, are putting their hands on them in a way that the animal likes, or maybe they're leading them with a balance leash instead of choking on the end of the slip lead. Owners talk to each other and they tell them, oh, you know what? I go to this hospital and my animal is, I don't know what they do, but my animal is so happy there. And word of mouth is the most powerful marketing that any vet clinic can get. And so it doesn't have to be a big deal. As Daniela was saying, it's perfect for busy practices because you're putting your hands on them anyway, and you're doing something that the owner can really see, wow, my animal really, really likes that. Or didn't mind that blood was drawn, or whatever it is. So talking about money can be really helpful too.
Yeah.
And owners actually don't know if your medical treatment is good or not, because they don't know medicine, but they all know if the animal likes to go or not. And I actually have to say, in the clinic where I worked for most of my veterinary life, we had lots of clients traveling. I would say they passed like 10 vet clinics to come to our place, and pretty much only because we do it nice.
Wow.
Obviously, they believe we do a good medical job, but there are many veterinarians who don't do a good job medical-wise, and people think they do good because they cannot compare.
Yeah.
Yeah.
Yeah. Yeah, nice. Well, and the simple things like the balance leash. I've been at the vets where I've just said to people that were sitting there with their dogs started choking on the end of the line is just slip your leash around the chest, and immediately the dogs come back into balance, so they're not on the slippery floor, and they reduces their sort of level of arousal. And it's simple. It's so simple, and I think that's really important, is being able to give things that are, and it's a health and safety issue for the vet nurses, because if you have a very strong dog, the balance leash will save your back. So Marie, did you have something you wanted to add?
Yeah, the other thing I wanted to say was, I think quite a good marketing point now with the pandemic, certainly at vets in the UK, at the moment, what has to happen is that your animal is attached to a lead outside the veterinary centre. You go back to your car, the vet comes out, collects your dog, takes it into the practice. You are not with it. They work with the dog, and then they come back. And one of the things that, and unfortunately this has recently happened with our elderly dog, he had to go in for an x-ray. And one of the things the vet said to me was, it was just so easy, because he knew them, and they knew how to handle him. So for vets that aren't using TTouch at the moment, it's a good parallel to draw for them, because they will all have had that experience of having to take animals who were really quite freaked out by being just led away from their owner, and handle that way. So just a small point for after, and to help them, because the point that Daniela was making about them just recognising the touches can make a huge difference to the animal. And it was very distressing to have to do as an owner, and because I don't work there now, I couldn't go onto the premises. But it was just such a relief to know that they knew how to handle him, and that he came back really happy.
Nice.
Cool. Yeah, because of the special corona situation, I was actually teaching several webinars here in Germany for veterinarians about low stress and how to deal with the situations. Most veterinarians in Germany still take the owners in. They just have to keep distance, but depending on local situations, some do it a little bit like in Great Britain, and we had 200 participants registered for that, and I never had such a high number for any veterinary webinar before.
Fantastic. So cool. Well, so if anyone's thought of any questions, they can unmute themselves. But if you come up with questions after, you can always put them on the Facebook page, or we can get them, and then we can ask you if there's some special questions that come up. So I want to thank you so much, and thank you all for coming, because I'm sure you will really learn from this, and enjoy the rest of your evening or day.
Thank you.
All right. Thank you all. Bye.
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 Thank you.
Bye.